Today they got the, Fox Eyewitness News, News 12 coming up in here. And you got ABC 6. Something must happen out here. I don't know. I would like to ask, but I guess that's not my place today. But they got their little gadgets. Something's going on in the school. So I want to know what it is. You got ABC 6 and you got Eyewitness News Providence. Fox Providence up in here. So whatever is going on over here today, I want to know. So just trying to find out. It's Ty Homie Gang family. I gotta keep y'all updated if anything's wrong.
What's been your experience?
Well, let's be clear. He said there's no barrier for a public health official to have a patient tested. There certainly are barriers for doctors across the country to get patients tested, and I've seen it, and I'm getting calls, both from governors and from doctors across the country. Various states, it's easy. Other states, it's very hard. So there certainly is not ability to get tested on a same-day basis across the country at the present time.
Doctor, what impact has the delay in available testing had on how we contain and mitigate this virus?
A patient last night, they called me, the CEO called me of the company and said, they just tested my employee and it's going to be 5 days till I get a result back. How do you do a containment when it takes days to know the answer of what's going on? And so there was a piece in the New York Times yesterday about in Seattle, they started testing people, but the government said, your test isn't approved, you can't do it, even though there were positive tests. And it delayed actually quarantining people or keeping people contained, and it enabled some of the spread that happened in the city of Seattle.
David, what are you telling people about when they should get tested?
Well, right now I say if you have mild symptoms, stay home, self-quarantine. The system can't handle large numbers of tests, and I don't want people waiting in waiting rooms at ERs and at hospitals. So limit the testing now until the testing is readily and easily available.
So the administration says that millions of tests will be sent out by the end of this week. What happens when folks get them? Who should be tested and how should they be distributed?
Well, realize what a test is. It's looking for 100 of the 30,000 letters in the virus, so 2 genes in the virus. And the government is sending out the template for those 100 letters. The problem is that all of the other reagents, which is actually to take the RNA out of the virus, the genetic material out of the virus, it was announced yesterday that reagent is short in the country. So even though the government's sending out tests, we're missing some of the reagents. And so what we need now are all the components of the test and people who can actually do the test out there, so we can test the right people. The more we test, the more knowledge we have, the more we're going to be able to stop the spread of this virus. In South Korea, they're doing 10,000 tests a day, and they've been able to stop the rise of the virus. And the virus there started when it started here in the United States.
David, I want to get a quick question in on our frontline workers, healthcare workers who are now being told they can actually wear a different kind of face mask after the initial kind that was approved is apparently running short on supplies. What do you make of this expanded recommendation that a mask that wasn't okay is now okay?
We had a national stockpile of N95 masks, which are the better fitting masks that can actually filter most of the particles in the air. And what happened is we never replenished that after the last supply was dwindled down. And so we don't have enough in the country now. You see nurses unions today announced that they're protesting the fact that we don't have the right protective supply for the front line, which are the medical personnel out there. This is a big problem. We certainly need a national strategy to deal with these supply chain issues because they're happening over and over again, and we have to protect everybody.
Dr. David Agus, thanks, David. Washington's governor is expected to ban gatherings of more than 250 people in most of the Seattle metro area. The state thinks it could get tens of thousands more cases of coronavirus. Public health officials say at least 10 long-term care facilities in the Seattle area have reported cases.
I know a
Patients
girl that
have
lives there
died
too.
at 3 of those facilities.
Hopefully she
Jonathan
alright. I ain't
Bigliotti is
speak to
outside
her.
the Life Care
God knows
Center in
how it's
Kirkland,
went.
Washington, the epicenter of that outbreak. Jonathan, how severe is the problem?
I don't know, but we're going to be getting Yeah, and Anthony, to put in perspective just how vulnerable the elderly are, of the 32 confirmed deaths around the country, 20 of them are linked to this nursing home. All of this as now state officials hear concern as well as residents remain on edge.
This is how Bridget Parkhill and her sister now visit their mother, who recently tested positive for coronavirus at the Life Care Center in Kirkland.
How did you process that?
It wasn't a shock that she was positive. It should have been a priority to get everybody tested so they could get all the negative people out of here before they turn positive.
But a shortage of tests meant only the critically ill were prioritized. At least 11 other long-term care facilities in Washington, including the Josephine Caring Community, now have infected residents or staff.
The facility is in lockdown, so no visitors, no consultants, and no families. And I can tell you that's incredibly tough.
In Northern California, officials confirmed Tuesday that an assisted living resident in their 90s died there. A recent study examining coronavirus cases in China found that in people over 80 years old, the death rate was nearly 15%. In Seattle's King County, 74 more cases were announced Tuesday, bringing the statewide total to more than 260.
If you do the math, it gets very disturbing.
Governor Jay Inslee outlined new rules for nursing homes, including limiting patients to one visitor per day and screening employees and volunteers for symptoms at the start of their shift.
The number of people who are infected in an epidemic like this will double in the state of Washington unless we take some real action here.
And if you have a loved one in a nursing home or a facility like this, experts have some recommendations. They say call the facility, check on their staffing and their cleaning procedures. They're also recommending keeping your distance. Call or use FaceTime if possible. And if you have a loved one inside, keep them there. Experts say it could be risky to remove them at this point. Tony?
Well, Jonathan, thank you very much. Former Vice President Joe Biden has expanded his lead over Senator Bernie Sanders in the Democratic presidential